Here, I'll be careful what I say. Look, the big issue is there's plenty of AstraZeneca around. That's not the issue, it's the Pfizer. And AstraZeneca is principally obviously being delivered through GPs. And the GPs have not been, there are not enough GPs to actually give the AstraZeneca. So the net result is we're encouraging the federal government to get the GPs. I mean, obviously, if you're taking AstraZeneca, because of some of the issues that have been raised by the federal government, there has been a degree of reluctance in some communities. But it's fair to say that there is plenty of AstraZeneca around both for GPs and for our state hubs. But our state hubs, let's not forget that the state hubs were set up to backfill and to fill in because the federal government wasn't actually getting enough vaccine out through the GPs. So we've done all that. New South Wales government, and I've got to thank again the medical staff, the nurses, the doctors who are at these hubs. They are ready to go with anybody who comes through those hubs, and we can certainly provide more AstraZeneca. I would like to take the opportunity, though, just to raise one issue, and that is, in terms of hesitancy around vaccine, I want to remind people that if you're over 60, if you get COVID, you have a 1 in 200 chance of dying. If you're over 50, you have a 1 in 500 chance of dying if you got the COVID virus. But in terms of the broader issue, it is far more effective that you would have the vaccines and make sure that you avoid those risks. Because if you have the vaccine, you have a 1 in 2 million chance of actually dying. So the odds are with you. You know, you could take a bet on TAB and you'd be doing far better if you'd had the vaccine. So, sorry, I enjoy your enthusiasm, but not that quickly and when it's so cold.
Victoria has rolled out 400,000 AstraZeneca vaccines. We've done 100,000.
I'll come back to you on that, but I tell you that we have actually done as much as is humanly possible. The issue is we need more vaccine. We need more Pfizer. And they're not. No, they're not. No, they're not. No, they're not. They're rolling. As the Premier just said, I'm sorry, you're wrong. What has happened is they've advanced some, and those vaccines are going out. We can't get enough Pfizer to actually fill up all the facilities we've done.
Minister Hazzard.
Lucy,
Minister Hazzard.
Sorry, James, Lucy.
Minister Hazzard, the Macquarie Fields vaccination centre is due to open in less than a week. That's on Monday.
Sorry, which one, Lucy?
Macquarie Fields.
Oh, yeah. Yep.
And people in the community out there say they're still unable to book. Bookings aren't open. They're wondering when they can get in. Is that going to open on time? And are people going to be able to get jabs from Monday?
The expectation is that it will open on time. And we're obviously doing all the necessary software to make sure it'll be available very soon. Yeah. Sorry.
Minister Hazzard.
Can I just do James and come back? Sorry.
Minister Hazzard, the Premier said that workplace colleagues are unfortunately the highest likelihood of transmitting the virus. But since the start of this outbreak, there have only been 123 cases linked to transmission in workplaces. Can you also get an update on... but there's only been 123 people who've caught the virus at work. Can we get an update on how many people have caught coronavirus on a work site? To repeat a question that we asked Health yesterday.
We'll get the stats for you. Yeah, sure. But the Premier would be surprised to know is right, but I'll get the stats for you later on. Sorry.
Question for the Premier.
You certainly can on the right, yes. On the right, but on the left.
A huge